introduce Kristina, who is one of our researchers in Leicester, who is going to talk about some research she's been doing, which has been evaluating what it's like living with IgA nephropathy.
Thank you. I'm going to double check that this works. Fantastic. So, hello everybody. My name is Kristina. I'm a renal research associate at the University of Leicester, but my background's actually in psychology. So I'm really interested in how patients experience things, but also those close to you. So you live with this condition and you have first-hand experience of this. So for me, I'm interested in your experiences directly. So today I'm going to be talking to you, it's because I'm short, thank you, talking to you about loin pain. So we were interested in, so to let you know, when I talk about loin, ribs to hips, front, back and sides, flank, mid to lower torso area. And I had a really interesting response to this research. So some kidney doctors I spoke to, they said, kidneys don't feel pain. And maybe if you've experienced this, you might have had a similar conversation where you say, oh, I'm having this pain in my kidney. And they say, but kidneys don't feel pain. Other people think that it's very rare, but we wanted to actually find out. So that was news there. So from previous research, we saw that this is mentioned in forums like the IgA Nephropathy Facebook group. It kept coming up there. When we were looking at the research into it, it was very dated. So 80s, 90s, it was in clinical reports, but these tended to be case studies of one or two, a few people, but nothing really recently. So some charities and health information pages include pain in potential symptoms, but this isn't consistent. And I'm going to show you some examples in a moment. But what we found was patients were bringing it up in clinic, and as I say, they were talking about it to each other. So patients were experiencing this. So here are some examples. If you go into Google and you click the right links, then you might see the pain is mentioned. But if you go to other pages, it's not. And you just want to find an answer. But because there's different reports there, it can be really confusing. So in previous work that was done at the University of Leicester, they looked at what was said in this kidney forum, so the IgA Nephropathy Facebook page. Kidney pain was mentioned. Patients were talking about this. It was described as pervasive, unwanted, intrusive, unrelenting, and dismissed by doctors. So patients were experiencing this, but they couldn't get support. So we wanted to find out what's actually going on here. We found out that in this previous study, it seems that this is an issue, but there's little to no data. We don't have any of the research to back it up. Absolutely nothing from the last 20, 30 years. There's no funding in the area, and as I say, the research is dated. So what's actually going on here? So we have suggested 3 phases in this research. First is to establish the scope. Okay, what's going on here? We want to understand the impacts on lives, so patients and those close to them, what is actually going on here? Is it a case that this pain is ruining your life? Is it a case it doesn't really bother you? And also, which is going to be the next phase, so not talked about in this particular talk, but what are the biological mechanisms that drive the pain? What's actually going on inside your bodies? So we had this 4 elements. So we wanted to find out, it's not very clear, sorry about that. So this research was driven by patients. They were involved in every single part of it. So when we were thinking about the questions to ask them, they reviewed this. We ran a national survey, and you may have heard of RADAR before, so the Registry of Rare Kidney Diseases. So we ran a pilot survey with everyone who had IgA nephropathy was invited to take part, and asked them broadly, what are your experiences? We also did qualitative interviews. So with the survey, you can get a lot of data, but you may have done some before where you have the options, for example, you have 5 options, but those 5 options aren't necessarily representing what you actually think, or maybe you're a 2 on a good day and a 4 on a bad day. So I sat down and had individual interviews where patients and their loved ones as well had the chance to talk about their actual experiences. We sat down for an hour. They described what this pain felt like, where it was in their bodies, how it affects them, and I got the detailed experiences there as well. So, large survey, detailed interviews. So we got both sides there. And then we pulled this together, and we also went back to the people we spoke to. So with some of the people who did interviews, we said, does this represent you? Is this what's actually going on here? To make sure the findings matched up with what patients were actually experiencing. So who took part in this research? So 358 patients took the survey, and they were aged between 19 and 89 years. So it was only adults that we were asking in this particular study. It was 66% male, 34% female. No one said other, but it was 90.3% white British. So as you were saying in a question with John earlier, lots of Caucasians in the room. And this was also the case in the survey we looked at. With the interviews, there was 46, so much less here because it's more detailed. It was 21 patients, 14 loved ones, so family. Carers was a word that didn't really fit them, but in research we use that quite a lot. And also we spoke to 13 kidney healthcare professionals. So we spoke to the kidney doctors as well. So what are their experiences and what are their thoughts? So participants who took part in the interviews were between 23 and 75, so a little bit narrower, but still quite a good range. They were 73% female and 27% male, so a bit different from the survey. We got a bit of a different side there. And they were 70% white British. So still, there could have been some improvement there, but 70%, it was still great to have the representation of the other 30% as well. So, main answer, do people with IgA nephropathy experience loin pain? 71% said yes. And that is the case that they've experienced it at some point in their lives. Within this, it was 43% within the last month, 28% at some point in the past, and 29% hadn't experienced it. So a lot of people were talking about this pain. And considering it wasn't mentioned in quite a lot of charity pages or NHS websites, then it's really interesting that so many were experiencing it. So of the 71%, is the loin pain always the same? 80% said yes. How often do they have it? 70% had it at least monthly. So this was something that was going on. What else did we find? So it's not significantly linked to EGFR, because your first question might be, is that just a sign of my kidney function going down? So in our analysis, we didn't find that. It's not just aging, so as we age, aches and pains become a bit more common, but actually it was younger people who are more likely to report the pain. And it's not just a case that you have another health condition going on. This wasn't linked to pain directly. How do people describe this pain? So it was consistently described as around the kidney area. So people were pointing on interviews as well, so they were showing me, but they were also speaking and describing it as, oh, it's around my kidneys. Some people explained it as, oh, where I had my biopsy. Very similar there. Most people described it as aching, so you think bruising, sore, aching pain. It was linked to viral infections, so if you start feeling a little bit fluey, then the pain was more likely to come up there. And people with young children, so anyone in nursery, you catch everything in that case, and they really notice this pattern. Also being run down and feeling tired, changes in urine, also different postures, so some things helped, some things didn't. For many, this pain was mild, so it was a case that they could get on with things. It was a little bit annoying for them. But there were people who had moderate or severe pain, and this did have a massive effect on them. So there's limited safe options for helping with this pain, and you might have seen this yourself as well, that if you want to take certain painkillers, you can't do that, it's not safe. So it was really frustrating when you had this pain, but there wasn't really anything you could do to make it feel better. When I spoke to the healthcare professionals, they said that they didn't really discuss it because they weren't concerned about it because it wasn't brought up much or it was mild, and quite a few said, but kidneys don't feel pain, this isn't an issue. But as we were talking about it, throughout the interview they were saying, oh no, actually, yeah, patients have brought this up. And it was a really interesting reflection place there. But it was rare that it was severe enough to be an issue in the healthcare professionals' experience with their patients. So what's the impact of this pain? What does it actually mean? So, like I say, the majority reported it as quite mild pain, not too bad. But the concern is, what does this pain mean? Does it mean that my kidney is declining faster? Does this mean that the worse my pain is, am I going towards transplant? So there was a lot of concern of, what does this mean? And especially for loved ones, if someone was saying, oh, I've got pain around my kidney, it was quite scary for them as well. So this did also have an effect on people's families, on people's loved ones. So social support was really, really important here. And when you are feeling more poorly, sometimes it's a case of things like childcare, things like household chores, things like emotional support. All of these things, having a good social support network around you, are really, really important. And if you don't have that, it can be really difficult. And just to highlight again, this really affects patients, but it also affects their loved ones. So there is both sides here. So it can also affect some elements of quality of life, but that depended on how bad the pain was. So we had to look at some existing questionnaires, which is what we do in research. So these were already used and they had been validated. So they have been used successfully in the past. So we had a look at some different elements about the pain in the survey. So with looking at how do people describe the pain, in people who had more recent pain, 17 out of 22 of these adjectives were significantly different between people who had recent pain versus people who'd had it at some point in the past. With self-efficacy, that's confidence in, can you do your household chores? Do you feel like you can have a job? Do you feel like you can manage without prescription painkillers? 8 out of 10 of those were significantly worse in people who had recent loin pain. There was also 6 out of 8 of the questions around the perceptions. Do you think this is going to last forever? Does this have a significant impact on your life? So all of these different factors were worse in people with recent loin pain. And when we had to look at all 3 pain groups, so we had to look at recent in the last month, historic, so at some point in the past, and also never, so if you've never had loin pain. So we also asked about kidney symptoms, and you may have heard previously that IgA nephropathy is largely asymptomatic until you reach kidney function decline. This isn't what we found. So with the frequency of different types of common kidney symptoms, 12 out of the 13 worse in people who were talking about loin pain, so more frequent. In terms of importance, so how much does this bother you? How important is it to you? 9 out of the 13 worse in people with loin pain. And these were all significantly different in our analyses. So here are some of the examples of symptoms that were more likely. So people were more likely to report feeling itchy, having issues with sleep disturbance, so things like insomnia, sleep apnea, reduced appetite, feeling more tired, joint pains, poor concentration, so things like brain fog, loss of libido, loss of strength, so if you pick up something, like how strong you feel about that, cramps, so especially in the legs, and restless legs. You'll see the number on the left is for people with more recent loin pain. And the number you see underneath, so where it says P is less than 0.0001. That's how much it's likely to be due to chance. And the more zeros you see, the more important it came out in our analyses. So what's next? We're going to publish the findings and share widely. So we want this to come back to your kidney doctors. We want this to be something that patients, their family members, they can find. Is it something that only affects IgA nephropathy? Or is it something that affects other rare kidney diseases? And we're looking into that as well. So that has recently been done. And then next will be the biological tests to see what we can learn. What is actually going on with your kidneys? So phase 1, establishing the scope of the problem. We found out what you've been experiencing. Phase 2, understanding the impacts on lives. This has been reported back to us as well. So next is looking at the biological mechanisms. So there was a wide team who were involved in this. It wasn't just me. And quite a few of them are here today, but there was a lot of support in going into this. So I just want to say thank you to the team and also to the patient groups who helped us with writing these questions, made sure that we were properly representing you. And also the radar team, because we couldn't have run this survey without them. So thank you very much for listening to my talk. I would be delighted if you want to ask me any questions, or we do have a coffee break after this. I'm very happy to talk to anyone. If you don't have a chance to talk to me today, or you think of anything later on, you are very welcome to email me. Very happy to talk about these with you. And if you'd like to hear more about the next phase, the biological side of the project, there's also an email that you can reach out to us here. So thank you very much for your time, and does anybody have any questions?
Did the survey establish any link between kidney decline or disease progression and the timing of pain or the level of pain?
So interestingly, no, that wasn't significantly different there, which was quite surprising to us. So is it something that's based on IgA nephropathy as a disease? We're not too sure, and that's what we want to find out in the next phase.
Thank you.
Thank you.
Can I just quickly add that also? So what
Yes.
Kristina thought, sorry, so Kristina thought that with the survey that we did, So with the survey that we did, we essentially asked people to tell us what their kidney function was. Let me just come to the front so everyone's not turning around, sorry. So we asked people to tell us what their kidney function was, and so that was self-reported. But what we're doing by connecting to radar is radar, whenever you get patient knows best, for example, all that blood test results that you get done goes into radar, and so it's de-identified, so we don't know who it's coming from in particular, but we can start linking things like loin pain to kidney function. So what we know is that it doesn't matter what your kidney function is, you seem to get loin pain. But if the question is, if you have loin pain, is there a higher chance of your kidney function going down? That's what we're going to find out next.
Choice of microphones.
Hello. The slide towards the end where you had different symptoms like itching and sleep, there was a sort of versus, 650 versus 29. I didn't quite catch what the versus was about.
Yes, so that was people who had recent loin pain versus people who did not have loin pain.